who have spent their careers charting the wellness of the 25 nations represented here today. And also today we are privileged to be joined by policymakers, public thinkers from the entire spectrum of our nation's life as we reflect on the future of our medical training, while we host this first biannual conference on harmonization of curriculum for training of our health professionals. Ladies and gentlemen, over the last 2 years, the world has been engulfed in a crisis occasioned by COVID-19, which has caused unprecedented disruptions across many sectors of our society. Arising from this pandemic, we know our medical professionals and healthcare workers across our country, our region, and the world over have had to bear unusually heavy burdens. Indeed, through the tireless efforts of our healthcare workers, the pandemic has largely been brought to the fore the pivotal role that you play in providing quality healthcare and contributing to the general well-being of our societies. Therefore, as nations of the world join the global quest to achieve the Sustainable Development Goal number 3 of ensuring healthy lives and promoting the well-being of all, we are challenged to reassess the training framework for those who bear the first level responsibility in the delivery of healthcare. In that regard, this conference could not have come at a better time. Indeed, it marks a turning point in our national quest to achieve universal health coverage. Each epoch of our nation has placed a unique set of demands on the skills and competencies needed in the workplace, which in turn has required us to reform and to recalibrate the content and architecture of the training we provide our healthcare workers. Today, I note with satisfaction that the conference will review key planks that can lead us closer to harmonization of the curriculum for health professionals training. And it is in this context that I invite you now to join me as we take stock and reflect and learn, and in particular, plan for the transformative changes that government should adopt in the training curricula for healthcare professionals. I cannot overemphasize that this conference has the task of providing a trustworthy account of the quality of our healthcare training. That account must give us a picture of what has worked and what has not, and the reasons why. The primary purpose here is to tease out lessons learned as well as best practices. But more fundamentally, we must ask ourselves, given the lessons learned, what transformative changes should we adopt, and do we have mechanisms of ensuring that these changes are optimally implemented? I therefore would like to propose a 7-point framework to all of you participants today. And this framework can guide us in understanding our performance and charting the way forward. This 7-point framework that I am proposing includes, first, defining a framework for harmonization of training of healthcare professionals across the sector for increased global competitiveness and future job readiness. Under this theme, the conference should on one hand consider how we can leverage on regional frameworks to harmonize curriculum and training to support cross-border training and practice. In addition, the conference should identify the gaps in elementary teaching and learning which ought to be addressed to ensure that a solid foundation is established before healthcare workers undergo their academic and professional training. Moreover, the conference should consider how the capacity of tertiary education, technical and medical training institutions can be augmented to effectively deliver quality healthcare training. The second is determining strategies to strengthen generation and use of research, innovation, evidence, and technology to inform policy and practice for increased access to health services. Under this theme, the conference should consider how the adoption of innovative and technology-driven mechanisms that are educative and informative in training of healthcare professionals workforce optimization through planning and forecasting. The fourth is to provide a framework for reimagining entrepreneurship and innovation opportunities for the health workforce towards increasing absorption of the same. The fifth is defining effective mechanisms for cross-sectoral partnerships and collaborations towards re-engineering the health workforce. Sixth is formulating necessary policy and regulatory frameworks to support strengthened training, development, and deployment of health workers in line with changing health needs. The seventh, enhancing governance in cadre recognition, schemes of service, and scope of practice for improved health workforce management and retention. So, ladies and gentlemen, as I conclude, I would like to state that I am persuaded that the consideration by this conference of this seven-point framework would enable us to deliver a trustworthy account of where we are on the overall quality of training for our health professionals. But more importantly, the questions will tease out lessons that will guide our future planning and herald a much-needed harmonization of training for all our healthcare professionals. So, ladies and gentlemen, let me say that we are all keenly looking forward to the outcomes of this conference, which I trust and believe will be useful to us as policymakers to be able to ensure that we are able to deliver, as our friend here has said, the kind of health care to our people that we ourselves would also seek to enjoy. And I do believe that here in Kenya we are making those strides. We may not yet fully be there, but we are definitely moving in the right direction. talking to Olive Mogenda over at Kenyatta University, it is great satisfaction to hear that the recently opened molecular institution there at KU has now treated over 200 patients, almost 20 patients every day, patients who would have been forced to travel to India for the same. It is even more satisfying to note that we are also receiving patients from across the region who are coming for that same service. Tomorrow we will be with Governor Joho, opening a similar institution here in Mombasa. If we just take those 200 patients alone and assume the cost to India for treatment, upkeep is taken into account, even if we just take it at 2 million shillings, that's 400 million shillings that have been saved and a cost that is covered under the National Hospital Insurance Fund. That is saving direct to the pocket of ordinary men and women in this country. It is also heartening to note that in some of our hospitals today, private hospitals are referring their patients to some of the public hospitals because some of our public hospitals are even better equipped than some of the private hospitals that we have had. And what does all this investment mean? It means that if we continue to improve these services, we save this country money, we save our people money, which can be put to other use. We know how health has bankrupted many families, many families, because there is nothing you can do. But now we are beginning to provide those alternatives. And what we must make sure is that we have the caliber of professional health worker that is able, operating within the environment we are providing in upgrading our hospitals, that we have trained men and women who can utilize this equipment and provide the best healthcare systems comparable to any part in the world. And I'm sure we can. Because again, as our friend has said, Canada, the United Kingdom, Australia, they wouldn't be here trying to get our nurses to go and work in their hospitals if we were not producing good quality people. We are producing. What we need is to ensure that the skills they have are equivalent to the kind of technology, as Waziri has been saying here, that is available out there. And they in turn will be able to provide our people with the same level of service as they are capable of delivering out there. Kwa hivyo, wenzangu, jameni, saa ingine muache kujipiga. Tumesonga. Na story ya watu huko kupepeta huko kwa mikutano, kuongea mauongo huko, haiwezi badilisha yale yamefanyika. Tunaelewana wenzangu? Let us remain focused. Let us remain focused. If there are things that are not right, that's why you're here. To help us, tell us, here we can do better, here we can do better, here we can do better. Lakini mambo ya kuongea maneno matuputupu huko, hakuna kitu unafanya. Unaenda huko, huko, kazi haifanywi juu ya gari, inafanywa kwa maofisi, kwa mahospitali. Ama ni namna gani wenzangu? Kazi inafanywa huko hospitali. Nasa endi huko kusimama kupiga mtu. Unajua mimi leo nimefanya, anaingia ICU, anaingia ward, anaingia theater. Nakwambia jameni, hii dunia yetu ya Kenya tutaona mengi, lakini ni sawa tu. Kwa hayo machache na mengi, it is now my distinct honor and pleasure to declare this conference officially open, and I look forward very keenly to receiving the report of the outcome of your deliberations. Thank you, and God bless you all.